to the Aortic YouTube channel. You're watching the African Cancer Research Corner. I am Professor Folakemi Odedino, one of the scientists anchor for the channel. I also have the privilege of serving as the chair of the Aortic Research Committee. As you know, September is Prostate Cancer Awareness Month. So we are highlighting Afrocentric scientific discoveries in the area of prostate cancer. I am really excited about today's segment because we are going to be talking about an exciting study that is going to be launched in Africa, and the study is known as the IRONMAN study. So without much ado, let's get started. We have three exciting guests. We are going to start with Dr. Mushi. Dr. Mushi, can you introduce yourself to our audience?
Yeah, thank you so much for the invitation to be a part of this exciting YouTube channel. My name is Lorelei Mucci. I am a professor of epidemiology at Harvard School of Public Health in Boston, Massachusetts, and I'm one of the co-principal investigators and serve on the executive committee for the IRONMAN study.
Great. And from, I believe, East Africa, Dr. Yedia, can you want to introduce yourself?
Thank you, Professor Odedina. My name is Charles Gethiaka. I am a practicing urologist in Nairobi, Kenya. I am the principal investigator for the IRONMAN study site in Nairobi. I'm also a member of AC3, which is a collaboration between Africa and the Caribbean about prostate cancer disease.
Awesome.
And I'm very happy to be in this forum tonight.
Thank you so much. Where I know it's night over there for us, it's like afternoon and it's morning. So what I love about global health. Everybody has different parts. Okay, so moving on to my home country, Dr. Popola from Nigeria. Do you want to introduce yourself?
Thank you very much, Professor Odedino. I'm Professor Ademola Popola. I'm a professor of urological surgery at the University of Ilorin Teaching Hospital. I'm also a consultant urologist at the University of Ilorin Teaching Hospital, a zonal coordinator of CAPC in Nigeria, and also principal investigator for IRONMAN in West Africa. It's nice being here. Thank you very much for inviting.
Okay, so perfect timing because my internet was going out. So I'm going to turn to Dr. Mushi. Dr. Mushi, can you tell us a little bit about the IRONMAN study? First of all, what does the IRONMAN, what does it stand for?
Yeah, IRONMAN stands for, it's the International Registry of Men with Advanced Prostate Cancer. And it's a global study of where we're recruiting more than 5,000 men, all of whom have either hormone-sensitive metastatic prostate cancer or who progressed to castration-resistant disease. And we're recruiting these 5,000 men from currently 14 different countries around the world.
Wow, 5,000 men. Okay, so we have to get to who is funding this kind of study. Can you talk a little bit more about where the funding is coming from?
Yeah, it's a really unique partnership of funding between the Movember Foundation, which supports men's health, including prostate cancer, together with 4 pharmaceutical partners. And so this partnership between a foundation and pharma funding to support the IRONMAN registry, I think that's really unique.
So why do you think this is important? Why is the study important? Can you highlight, especially in advancing the science of prostate cancer?
Yeah, no, so the idea for this study started about 3.5 years ago to really address a lot of the unmet questions we have specifically for men with advanced prostate cancer. So with this registry, we're collecting a lot of different types of data. We want to understand what are the patterns of treatments for men with advanced prostate cancer really around the world and how those differ in different countries and different regions within a country. We want to understand quality of life and patient-reported outcomes for men with advanced prostate cancer. We want to understand what are the biomarkers that might help us to tell whether a man is going to respond well to a certain therapy or whether he might have an adverse reaction with a specific therapy. And then finally, to look at how can we improve overall survival for men with advanced prostate cancer. And so we really think that in order to do this, a global study is so important to address these important challenges.
This is so awesome. And I can't wait to talk to Dr. Pokuola and Dr. Yediaka on this. But before I move to them, can you just explain to us why the interest in including Africans in the IRONMAN study?
Yeah, I think there's a lot of reasons, and we're really excited about this partnership. First of all, mortality rates from prostate cancer, unfortunately, are high in certain countries in Africa. But yet it seems that when you look at all of the randomized trials that have been done in prostate cancer, there's very little participation or inclusion of sites in Africa. So if you really want to understand and move forward this field and try to really improve outcomes for men with advanced disease, we needed these partnerships in Africa. We need to have men included in these studies. So we think it's really important a component of the study.
Yeah, thank you. Dr. Pokuola, so let me ask you, when you first of all heard about the IRONMAN study, what was it about it that you think would be of great interest and benefits to Africans?
Thank you very much, Professor Dedino. For Africa, especially Nigeria, where I live and work, has a population of about 200 million, and more than half of these people are men. And many of these men, as we know from statistics, they have predisposition to developing prostate cancer. And the problem we have with prostate cancer in Africa is many of the men come late in advanced stage. And that's what IRONMAN is for, men with advanced prostate cancer. So I was quite excited getting to know about this project. We're talking about my patients who are patients with advanced prostate cancer, and having to go through IRONMAN, I know it will be a great benefit to the African population, especially Nigerian men who come with advanced prostate cancer, to do so much for them, because we need a lot of more understanding about advanced prostate cancer, the presentation, why they present late, and what are the response to treatment. And that's what IRONMAN is out to deal with. So it will be an exciting time working through IRONMAN, even for Nigerian population, especially the men, and we look for a better outcome after going through this IRONMAN project. Thank you very much.
Thank you. Dr. Yediaka, is this the same thing that you see in Kenya, in East Africa?
Yeah, in Kenya especially, we have also patients presenting with late disease, and 80% of the patients we see with prostate cancer have actually late disease. Just some statistics about Kenya. It is the most common cancer among men, with 15.6% of all cancers that we register in the National Cancer Registry. We have an age-specific rate of about 40.6 per 100,000, and the mortality rate of 18.3 per 100,000. What is more interesting about the diseases Kenya is that most of the treatment, and especially what we are going to investigate in the IRONMAN study, we only have 1 or 2 chemotherapeutic agents, while most of these things are based on the Western literature. So we are very much interested, how does our disease differ from the disease in the Western countries? Mm-hmm. And at the same time, see how the Western countries can help us manage our disease better, and probably get an improved treatment outcome, and of course, overall survival.
Yeah, that is so important. I mean, you are mentioning some of the key things that we're going to be getting into later on, which is the accessibility of cancer medicines. But how many sites is included in Kenya that are going to be part of the study?
In Kenya, we are going to have 2 sites. We are going to have MP Shah Hospital, which is a private hospital, which has a very well running cancer center. And the biggest national referral hospital, Kenyatta National Hospital. And at the moment, we are at the stage of introducing our proposal, which is actually customized to our local need, to the IRB.
Yeah, awesome, awesome. So Dr. Popola, I know that, you know, it's a little bit different the way this is being implemented in West Africa. In fact, that there are quite maybe 1 or 2 or 3 phases that you are looking at relative to the implementation. But let's start with how many sites overall are interested in being part of the IRONMAN study. And then you can tell us about the sites that are going to be included in phase 1.
Thank you very much, Professor. In Nigeria, we have about 20 sites that have indicated interest in IRONMAN. As I introduced myself, the PI for West Africa, we also have sites in Ghana that are also ready to join the IRONMAN project. The KTC also includes a site in the Cameroon, also ready to join. But presently, we are starting with this phase 1 with 10 sites, 10 institutions grouped into 4 sites, regions. So they are already set to go with IRONMAN. And some of these hospitals are some of the biggest hospitals in Nigeria. Like the hospital where I work is one of the 2nd generation hospital. We have 1st generation hospital as part of this project. In Lagos, 2 major institutions. We have across major parts of Nigeria up to the northern part of Nigeria, Maiduguri, which is one of the biggest hospitals in northern parts of Nigeria. So far we have 10 that are ready to go with this first phase. Thank you.
Yeah, great. Dr. Moshe, before I go on, because I really want to get into, you know, when you're introducing a study like this, you know, especially in Africa, where you have different healthcare system and where you have different resources, there's some key issues, which I will actually love for the PIs to share with us, right? But before the PIs talk about that, you know, when you decided, Dr. Moshe, to say, okay, I think we're going to go into Africa, what were some of the greatest fear or issues that you had in your mind that had to be overcome to be able to successfully implement IRONMAN study in Africa?
Yeah, well, thank you so much. I think that's an important question in any type of global research that we're doing. You know, I think for us, what we saw in some of the early countries that came on board to IRONMAN was the success of IRONMAN in that country really was contingent on having a strong partnership in that country and having a lead team that would be able to not only recruit men, but maintain the enthusiasm and be a real active partner with us in this study. And so I think that for us, not having those partnerships ourselves, you know, made us so worried. So we were so grateful to connect, for example, with both CAPTC, AC3, and the teams there who made these introductions, and really the partnerships that we found, I think is going to be so pivotal to the success.
Yeah, thank you for saying that, because, you know, one of the series that we are actually doing is looking at team science and consortium science, and we are going to be talking with different consortia on how this really helps to bring the science to Africa. So I believe that is important. So Dr. Popola, you get to wear the hat of the West Africa hat and ask, you know, what are some of the key issues that we need to address? Can you tell us what was one of those issues that was very important in your mind that you thought we really need to address this before we bring IRONMAN to West Africa?
Bring IRONMAN to Africa, I think one, get the scientists, the practitioners to get our care of patients with prostate. Because as we go through the IRONMAN project, we're looking at practice, patient response to therapy, how the response to therapy, their presentations and the outcomes from the therapy, and changes their responses to therapy, and how they go on with treatment. So that's very important before we bring IRONMAN Africa, because IRONMAN will be looking in its entirety our care of patients with prostate cancer. And with the study, we'll be able to identify use in improve patient outcome in this project. The project outcome of patients' management of prostate cancer. Thank you.
Yeah.
So the professional needs to know on the same page.
I think Dr. Pokola was saying being on the same page is very important. So Dr. Yetiaka, can you tell us what is unique? What is one thing that is unique to East Africa that you thought this really needed to be addressed before bringing the study to Kenya?
Bringing the study of the IRONMAN to Kenya has been, I would say, a blessing to us, because one, we do not have treatment guidelines. All the oncologists involved in treating prostate cancer, they use their own, what they think might work, but probably they refer to other guidelines in the Western countries, and maybe sometimes the NCCN guidelines. So bringing the study to Africa would help us to be able to know exactly which patients require what particular treatment, whether they will require hormonotherapy, they will require chemotherapy, and sometimes some of these treatment modalities are too expensive, and probably they don't change the patient's treatment outcome or even overall survival. So from the word go, if we know that this particular patient is not going to respond to this particular agent, then we need not spend the money. As you know, like I said, there are 6 new agents that we have in the IRONMAN study that was introduced by the year 2010. And probably only docetaxel and enzalutamide recently has been introduced to the treatment. Then we have the secondary hormonal treatment, the Zytiga or abiraterone, which actually costs here in Kenya about $1,000 per month. Most of our patients cannot afford that. And sometimes you don't even know whether they will respond to that. So with this kind of study, we'll be able to know, are we wasting the patient's money by putting them on this particular agent, or we can start on one particular line that will help them. So we think it's going to have an impact in our treatment guidelines in Kenya, and of course, Eastern Africa and the whole of Africa.
Yeah, thank you. So kind of taking that is like one of the issues on the ground would be the treatment guidelines that really need to be developed to be able to have like better outcomes in patients. That is so important. Dr. Moshi, I know that this study is just getting started on the way to be implemented in Africa. But are there some of your key research findings from the IRONMAN study that you believe might have implications for Africans?
Yeah, so one of the, we now have in IRONMAN the first 1,500 men enrolled, and for some of them now we even have, up to 2 years of follow-up data on, particularly on the patient-reported outcomes for these men. And I think there's some of the quality of life indicators that really seem to differ for Black and white prostate cancer patients. One of them is around sleep quality, where the Black men in our study seem to be reporting worse sleep quality compared to the white men. In addition, the Black men in our study are reporting higher levels of pain. Even if you account for the fact that there was a different prevalence of metastatic hormone-sensitive versus castration-resistant disease, even accounting for that, there still seems to be an excess risk of pain. And trying to understand that issue, which really is to be living with pain is just a horrible impairment of quality of life. And so understanding that, I think, is going to have really important implications. Is it something about the treatments these men are on? Is it something about the disease itself? And then also, can we have an impact on quality of life and intervene in some way to improve outcomes for these men. So I think those are some initial findings that I think will be very important to try to understand in the context of men in Africa.
Yeah, that is really very interesting. And I think this is one of the things that I really like about the IRONMAN study is the ability, being a global program that is recruiting diverse populations that includes people of African ancestry globally. You can actually look at the environmental changes in the healthcare system as they impact the outcomes for the patients. So, Dr. Kokola, do you think you may be able to see similar pattern as mentioned by Dr. Mushi? Do you think there might be some issues of sleep patterns in the populations in West Africa?
Well, sleep pattern, well, we need to go through the study to but what we have seen is some heterogeneity, even with patients within the African population, within the Nigerian population. We see patients with who respond, the prostate cancer is very slow growing, and patients actually live their life through without any major issue from the prostate cancer. And then even with Nigeria, we also see patients who come up with rapidly progressing disease and eventually die no matter what you do. I believe the IRONMAN study may show us the differences in why this is so, because there are going to be some genetic studies with this in addition to other things. Why? There may be some differences even within the Nigerian population of patients with prostate cancer. I look forward to having this seen through the IRONMAN study, because we then need to understand why some patients will behave differently from the other, even within the Nigerian population. And that will help us even in planning for treatment for these different groups of people as you see them later. So I look forward to that and other issues related to changes in their sleep patterns and so on. That would be interesting to know also. Because we have a robust proforma that's going to capture most of these things that will show us the differences, many things, differences that we never thought of are likely going to be seen after these studies.
Thank you. That is very well said. Dr. Yediaka, what do you think are the potential benefits of the IRONMAN study? We know that is an observational study. We know that is a naturalistic study. That means it's really just looking at what you're finding on patient-reported outcomes and there are no interventions. But even in spite of this, what do you think are some of the potential benefits that the IRONMAN study brings to Africa?
One thing, it's very difficult to design prospective studies of this magnitude. So the reason we suggested or we decided on retrospective study in these patients was because we are going to have a very large cohort of the 5,000 people. And Kenya, we were to contribute 150 patients. One thing, patients who are undergoing treatment with advanced disease normally have issues in quality of life. They have fatigue, they have stress, they have pain, they have depression. And most of these, what we call the patient reported outcome measures, normally you will find they have something to do with the treatment that we institute on these patients. So if we know a particular agent will be better for this particular patient and avoid this kind of side effects, I think our African patients will be very beneficial. In our part of Africa, other than lack of maybe the money to buy these agents, we also have other issues of the socio-economic status of this patient. And I think this study is going to address some of these issues. We'll be able to match patients with the best treatment that they need. And again, also will be part of the world, the global world, in terms of addressing some of these issues in men with advanced prostate cancer. Rather than we cannot.
Yeah, very, very well
not be
said.
left behind. Yes.
Thank you. Very well said. I think one of the things that, Dr. Moshi, that that I keep hearing is the issue of the access to medications, what is available in Africa. And that I think that is one of the continental wide problems that, majority of African countries, especially countries that are in the sub-Saharan, have. So given that access to medication is really one of the major barriers, is there a plan by the IRONMAN team to leverage the study and leverage your sponsors to be able to ultimately improve access to cancer medications in Africa?
Yeah, no, I think that's a really critical and urgent need that we do hope that IRONMAN can play an important role. One of the ways that we've been trying to make IRONMAN successful is through several different working groups that we have. And one of them, actually with your leadership, that was created was specific to addressing the challenges in low and middle income countries. And I hope together with the executive committee, we can work with, for example, our partners in the pharmaceutical companies that we're working with to think about ways that we can bring drug to the men in these countries. It has to happen. We can't simply be taking data. We need to be giving back through IRONMAN. And I think there's a lot of momentum that we need to capitalize on and make this happen. And so I'm very optimistic that through IRONMAN, we can make partnerships that will allow this to happen. It has to happen though. Yeah.
Very, very well said. Still staying with you, as you know, increasing biomedical research workforce is really also very important for Africa. Knowing the expansion of IRONMAN to Africa, and I know that the IRONMAN study does include some training components that that investigators in Africa are going to have access to and they are going to undergo. But is there any additional plan for your team to help in the area of biomedical research, workforce training or increasing the biomedical research workforce in Africa?
Yeah, no, that's a really fantastic question. And I think it's something that really should be really nicely integrated into IRONMAN. So one thing I'd like to say, first of all, is that we really want IRONMAN to be a global resource for researchers around the world to address the pressing questions that they have. So we really want to open this up to all researchers, including the early career investigators. So I think that's one thing. The second thing is that we really have this wonderful team now of scientists, clinicians from all of the sites within each of the countries, and we meet together either remotely now because of COVID or hopefully in person at some point.
Yeah.
And so it's created this really wonderful network where you have, again, more earlier career investigators seeking mentorship from more senior investigators at different institutions. Mm-hmm. Right now, it's still very informal. I think we should really talk about making it a more formal process where we can set up partnerships for people who are interested, for example, in coming to do a rotation at an institution, getting funding that could support those kind of, mentored experiences. I think it's something we need to really think about doing more formally, and thank you so much for raising it here. I think it's a great idea.
Yeah, thank you. That really would be very awesome, and I think it's really a perfect way of the ability to give back to the investigators who are going to be part of the IRONMAN and still can also begin to lead some other associated studies. Yeah. That are part of IRONMAN. I think that would really be great. So I'm going to go to you, Professor Kokola, and one of the things that I want to have you, as we wrap up this interview, is for you to, as you think ahead to what needs to be implemented for the IRONMAN study. How do you see this changing the way that research is being done, especially for clinician scientists like yourself? One of the things that is really a struggle for clinicians in several places in Africa is to be able to include research in their work. So in thinking ahead as this opportunity for IRONMAN, how do you see this changing the landscape of clinician scientists like yourself to be able to do more research?
Yeah, thank you, Professor Dedino. I want to use the opportunity to thank you for your vision in linking us up with the IRONMAN project. One, the IRON project is an observational study, but I want to say it's a deep observation because we have been observing as clinicians, but there's a limit to the depth of the observation without support like the one coming with the IRONMAN. We're looking at the patient in totality. We're looking not just at the prostate cancer, we are looking at the person of the patient, the the quality of life, and we're also looking at genetics. We're looking about the treatment. So that gives you a broad about the patient, so that when all these results, everything at the end of the project, you then have a deeper observation of the patient that you have been caring for. You know what you should do for a patient that presents in one way, and you know what the outcome is likely to be, and also you also know what drugs are likely to work for a patient that comes in such in one way or the other. And then with the help of the genetics, also know even from our own populations, different patient group of patients within the population. So as a clinician scientist, it will also help me look beyond what you see in clinical examining, operating, and so on. Because there are more reasons why patients present in diverse ways that a typical clinician is limited. But with further support, with genetic studies, and also looking at the patient in the whole, in his reality, you become a better physician, you become a better clinician, and also you also you become a better, you know this patient clinically, and you also know the patient scientifically. That helps you in your care of future patients that are going to be better than the ones you have managed to pass. Thank you.
Thank you. Dr. Yeteyaka, how does that translate in East Africa?
I think it is a very good opportunity for the clinician scientist. One thing, as we know, it's very difficult to be in clinical practice and also in research.
Yeah.
And I can tell you it's not easy at all. But I think in the future, we need to encourage this kind of working and the partnership. And we appreciate the IRONMAN, the AC3, and the CAPTC for allowing us to be in this kind of forum. The other thing is, I think in the future, there are many clinicians who are probably even interested to go the line of research so that they can actually be like, they will be able to help the clinical doctors who are working on in their hospitals to be able to change their treatment ways, the way they treat the patients. And I think in Africa, we have very little research going on. Even the registry I was quoting about, the National Cancer Registry, is still very poorly kept. And I think with this kind of funding from the IRONMAN, I think that will help us so that we have a better evidence-based medicine where we treat patients with the best modality rather than some kind of trial and error. And I think it is very exciting, especially this kind of collaborations. The Zoom, the coronavirus has taught us a lot that we can talk.
Yeah.
We don't spend any money to travel to America or to Nigeria or to Caribbean, but we can be like we're in one room. And I think we do appreciate this kind of forum.
Yeah.
One other thing I want to say, the IRONMAN is going to be following patients about their overall survival, the significant side effects of the medicine they are going to be taking, their comorbidities, whether they have diabetes and other cancers, And also, when we change their cancer treatment, what happens, even towards their genetic composition? So we are going to also go to the molecular biology of these patients, and then we are going to have a real evidence-based research. And of course, the patient-reported outcome measures. Yes.
Yeah. Yeah, thank you. I mean, this is really, to be honest with you, and wearing my hat of the chair of aortic aortic research committee. This is one of the things that Ironman popped into my mind when immediately we established YouTube and said that we want to really show the scientific discoveries that is going on in Africa, and we want to show, what can African scientists, do. And we've had a couple of programs already, and it keeps emphasizing the importance of teamwork, the importance of having this global landscape of scientists coming together to be able to do some work. So I'm going to sort of, before I allow you, Dr. Mushi, to kind of talk about, what next and what any additional things that you want to add. And I think I want to send a plea to you, not only on behalf of, the CAPTC or AC3 team, but on behalf of aortic and on behalf of African clinician scientists. I think this is an area that is very important. Building a capacity for clinician scientists to be able to do this work is really outstanding. And I know that due to the nature of the Ironman is one of the very few projects that I know of that can facilitate building the capacity for clinician scientists in Africa. And so I'm very hopeful, I'm very encouraged, and I'm very proud of the work that you and your team are really doing, because you are very selfless about it, and I see the passion, and I see, the interest in Africa it has nothing to do with getting data out of Africa. Your interest in Africa, from the conversation that we've had, really has to do with actually building the capacity in Africa. This is one of the things that I really love about the Ironman. So, okay, enough about that. So can you tell us, is there anything else, Dr. Mushi, that you would like to say about the Ironman study and its presence in Africa?
Yeah, I think one of the things that we want to think about with Ironman more globally is that although right now it's an observational registry, we have the opportunity to nest interventions into the study. We have one small project that's funded now where we're going to actually follow about 400 of the men in Ironman and looking at their quality of life data over time. And when one of the measures sort of gets to a danger point, we'll do an intervention with the goal of, can we improve quality of life, and can we even improve overall survival? I think there's a great opportunity to think about larger projects. We've talked about some ideas about interventions with things like medications or diet or something like that. So thinking about Ironman, both as an observational study to answer research questions, but also the future to have nested interventions within the context of Ironman, is really exciting. And again, we're looking for our partners to make those suggestions and think about what's best within a specific region.
Absolutely, absolutely. So the Aortic Nest Conference is going to be November 2021. So I'm using this opportunity to invite everybody to make sure. We would like to see Ironman team, the global team, but especially the African team. If you have, even if it's not data that you have, but you have, you have some specific things about implementing such a study in Africa, what it takes to implement such a study, please submit an abstract to the Aortic, because we would like to highlight, this kind of global collaboration during the Aortic conference, definitely. So, going to give the last words to, the two African clinicians that we have. Professor Kokwala, anything that you would like to add? I think you're muted.
Yes.
There you go.
Well, I would like to thank you for inviting me to this program, and also thank IRONMAN project for look how to our men in Africa, how we can get better results with our men with prostate cancer. Like as has been mentioned earlier, prostate cancer is the major health burden in Africa, especially in Nigeria. And being able to care for this patient better than we are doing before, especially with our knowledge and understanding of the prostate cancer from IRONMAN, and also with the prospect of being able to come further with their drugs, is being able to help them further with their drugs would also help us even to benefit more from the IRONMAN. Once again, I want to thank you for inviting me, and also looking forward to a greater prosperity with IRONMAN in Africa. Thank you very much.
Thank you. Dr. Yediaka, okay, you get the last words.
Professor Dedina, it was a good evening, like you said, here in Nairobi. It's just about 9 p.m. in the evening. Thank you very much for inviting me to this forum. And I would want to request the IRONMAN, just like Professor Popola has said, that probably you can avail some of these chemotherapeutic agents that are not available here in Africa for our patients, so that they can be enabled to continue with their treatment to the end. And at the same time, even if you don't give them for free, you can negotiate with the multinationals who are actually selling these agents to us, so that they can put a special price for Africa. Because $1,000 in a month, very few patients can afford that. And at the same time, we thank you very much for allowing us to be part of you in the IRONMAN. I know the budget is not small, but I believe it will benefit both the taxpayer and also the poor man in Africa. And with those few remarks, we are very grateful. Thank you.
Thank you. That is very well said. It's really been a pleasure, for our viewers. IRONMAN is going to become a household name. I tell you that, because it's going to be doing wonders across Africa, studying men with advanced prostate cancer and how to appropriately treat and improve survivorship among our men. So it's really been a great pleasure. I want to thank everyone for taking the time at a very short notice to come and talk to on AOTIC YouTube channel about prostate cancer research going on in Africa. Thank you so much for joining us today, and until next time, we really appreciate your presence. Thanks.
Thank you so much.